The center has provided kind of an intellectual hub for work together that's led to new successful grant applications, new training programs, and new research and programs all across campus.
It's all about interdisciplinary collaboration. We have individuals that have expertise in public health, in school mental health, in psychiatry, in education, in social work, in school nursing. So trying to get all of those partners at the table. We have started a mindfulness-based intervention with 9th grade students. And another research project is we're calling it Imagine Iowa, the Iowa School Mental Health intervention. And it's a curriculum for teachers to gain mental health awareness skills so they're able to identify issues as they come up with students, but also have the skills to address them and then to refer them to professionals if they need additional assistance.
With the Imagine Iowa project, which is a mental health awareness training program, it's taking the responsibility off one person, off just a school counselor, off just a teacher, off just this one designated school mental health ambassador. It's saying like, everyone in the school building can support the mental health of students.
So the hope is that we have data that these projects are effective, and the hope is that we have students that have better coping skills. They're able to identify their own stressors, know how to connect with teachers and their support system, and are able to cope with things as they come up so they can stay academically focused and engaged. And for the teachers, we're hoping that they have the resources they need to feel like they have the skills to talk to a kid that has a mental health concern. I think it's important to identify what works best for whom and under what circumstances. And very often, a one-size-fits-all is not going to work the same for, let's say, a rural high school or a high school that has high rates of free and reduced lunch for students that are in poverty. So we're trying to identify what works best, what is effective, what is a good use of our time and skills, and also what can be replicated. So we can give to the schools and say, hey, this is pretty doable and it has pretty good outcomes. Here, you go and run with it. So I think that's why it's important to actually test those interventions in real schools.